And welcome back to Deuk Spine Institute. Our patient has lumbar facet joint pain. His back pain is coming from the facets at L3-4, L4-5, L5-S1 on both sides. We're going to perform the Deuk plasma rhizotomy. This is a proprietary treatment developed at Deuk Spine by myself. And it's a treatment for something called facet joint pain. So what is facet joint pain? It's back pain that comes from a small joint deep in the spine called the facet joint. Now, facet joint pain is probably the second most common cause of chronic back pain. In other words, take 100 people with back pain that they live with every day and analyze, why does this person have back pain? 50% of those 100 will have facet pain. 50%. 85%, actually 90% will have disc pain. Of those 90%, 85%, it's due to the primary cause of pain is the disc. You guys following me? Yeah? So, of the 100 people with chronic back pain, 85% or 85, their main cause is the disc, like this patient. We just fixed his discs. Now we're working on his facets. All right, that's the L5 facet, transverse process, and I am destroying what's called the medial branch of the dorsal ramus. Now, Henry, let's show the audience how the Deuk plasma rhizotomy works, but also how is it that facet joints cause so much back pain?
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back, Sean. All right, you can see from our video that the facet joints become injured through trauma, just like the disc. As a matter of fact, their injuries happen at the same time that people get disc injuries. However, when the disc gets injured, you get a tear in the wall of the disc, called an annular tear. When the facet gets injured, you get a tear in the capsule of the facet joint. Well, that capsule of the facet joint becomes inflamed, just like the disc becomes inflamed. You agree, Jordan? And when that capsule gets inflamed, it starts to hurt, right? Remember, inflammation causes pain. So that inflammation in the facet joint capsule is the source of facet joint pain. I'm trying to get this probe exactly where I need it, which I think I just got it. Yep, that's perfect right there. 1 minute left, Berndes. And we're done with 2 nerves out of 4 on the left side. We've already completed the right side. My target is the transverse process, right where it joins to what's called the superior articular process, which is basically the bottom half of the facet. This is the same target that doctors use for rhizotomy. The difference is, sorry, for RFA. The difference is my rhizotomy is much better than an RFA. Why? Because I'm actually destroying the medial branch of the dorsal ramus, aka the pain nerve. They are not. They're just burning near it.
Sitting on, please.
All right, we're done. Any questions?
No current questions.
Wonderful. So this is a lumbar rhizotomy for facet joint pain. Thanks for joining us. Luis, great job. Dr. Berndes, great job. Thanks for joining us, everybody. Sam, thank you. Jordan, Nikki, everyone, great work. We'll see you.